Hi, I'm HD. Welcome to season 9 of HD's Jazz. And this season we'll be coming to you from the hills of St. Andrew. Can you see the lovely Kingston city behind me? Kingston Harbor, New Kingston, and Halfway Tree. But I have a question for you. How nosy are you? We're in the beautiful hills of St. Andrew. Can you see the fabulous view behind me? And this morning, I'm speaking with our guest, Dr. Francis Barnett. He's an otolaryngologist. Big word.
Hello. Glad to be here.
Glad to see you. Mm-hmm. Can you tell me what that word means, otolaryngologist?
Otolaryngologist is a fancy term for ENT surgeon. And we are primarily a surgical field. And yes, everybody knows the ear, nose, throat surgeon, but classically we were head and neck surgeons and still are. We do a lot of things outside of the ear and the nose and the throat. So we deal also with a lot of neck disease, so goiters, parathyroid disease, head and neck cancers, which is a big part of what we deal with. But otolaryngologist is just a fancy term, really, and it truly belittles everything that we do.
Well, I learned something today. Well, I'm not going to focus so much on the ears, but noses. So many people have issues with noses. I work in the mouth, but I look up noses all day long. Tell me some of the challenges, some of the common problems why we are not able to breathe properly through our noses.
Oh, stuffy nose is a very common symptom and a miserable symptom also. And one of the commonest causes of having a stuffy nose is allergies, allergic rhinitis, which is allergies affecting the nose. And these allergies set up inflammation. And so the inflammation leads to swelling of the lining of the nose. And so it narrows the air space within the nose. So there is not enough space to breathe through. Something else that is common is sinusitis. And this is very, very common. The sinuses are air-filled spaces within the bones of the face, and they open into the nasal cavity. And the sinuses are, the lining of the sinuses produce mucus. And this, when the sinuses become infected or inflamed, pus and so on can form within the sinuses, and this can drain into the nasal cavity and leading to inflammation in the nose again. And so this inflammation in the nose is what sets up a lot of this stuffiness, the drainage to the back of the throat, pain over the face, you know. And these are symptoms that commonly go with the stuffy nose. In kids, something that is common for a stuffy nose is adenoids. And these adenoids are swellings that are behind the nose. And we really can't see them by looking through the nose or in the back of the throat. But sometimes these symptoms that I just mentioned, the stuffiness, the runny nose, etc., can imply that this is there. So these would be probably the 3 most common causes of stuffiness that we have,
Okay, what about the person who maybe was playing football at 11, got hit in the nose, it was swollen, seemed to have resolved itself, but possibly a fracture that wasn't healed. Would that be a challenge?
Yes, that definitely is. The nose is separated by a septum, something that divides it into 2 halves. And sometimes this septum or column it fractured when you were playing sports, or it can even fracture while coming through the birth canal. And so it's pushed over to one side and so narrows the nasal cavity on one side. And so this can cause stuffiness, right? But it's not as common in our population. Black people have a bigger nose than the white person, and in Caucasians, it tends to cause a bigger problem than it does in our population.
Well,
but it is possible.
That is so good to know. So, I always hear the word adenoids, but I link it to tonsils and adenoids.
Right.
So it's possible that the adenoids are problematic, but not the tonsils.
Interesting that you said that the tonsils and adenoids are the same type of tissue. They are lymphoid tissue. And so often we do expect that if one is big, the other is big, but it's not always the case. It's not always the case.
So I have $1 million question for you.
Okay.
Because just as how I look up noses, I look and see the back of throats all day long.
Right.
And it is so common for me to look, especially children in Jamaica at the back. And you see these two bulges, the tonsils and the uvula sticking down. And between those three entities, there's literally no space.
Right.
And oftentimes when I question the parents of the child, I'm told, well, the doctor has them on medication. And I don't know at what point we move from saying medication is not enough to doing something a little more involved. Can you talk me through that a little bit?
Right. These pictures that we're looking at, these swellings are the tonsils. And the tonsils, especially in kids, can cause two primary problems. One is obstruction, and this obstruction tends to affect the child mostly at night while sleeping.
Yes.
A blockage,
Okay.
right? And so the child is sleeping because during sleep the muscles at the back of the throat relax.
Yes.
And I tell my patients that it's similar to sucking on a straw, and the straw collapses as you take a deep breath in. The back of the throat collapses, and so airflow is reduced. And this airflow, because you hear it struggling through snoring.
Yes.
The sound that it causes. This obstruction can lead to total cessation or no flow at all, and we call that apnea.
Yes.
So some kids and adults have something called obstructive sleep apnea. And this can lead to a variety of symptoms. In kids, it has been shown that it may lead to attention deficit issues.
Yes, I've heard that.
And in kids, it can also, they lose their concentration during school and learning, and may be left behind a little. And so when kids have this obstructive problem, then this thing is serious. The other problem that large tonsils can cause is infection. And this recurrent infection may lead to a sore throat or identify itself as a sore throat. And this can lead to a loss in productivity. So kids don't get to go to school as much as they should, and adults don't get to go to work as much as they should. Unfortunately, the size of the tonsil, some people just have big tonsils.
Yes.
And it's not really a reflection of an ongoing infection or inflammation. And so antibiotics are unlikely to reduce the size of it, especially if there is no evidence of an infection at the time. And so unfortunately, when kids have an obstructive problem or a recurrent infective problem, then a tonsillectomy can benefit them significantly. Okay? I should mention though that in adults, which is something on the rise, is tonsillar cancer. And tonsils can harbor cancer within them that are not obvious on examination. And something very important for adults, if there are tonsils that they're asymmetric, meaning one tonsil is bigger than the other, it should be taken very seriously. Yes. Because tonsil cancer is increasing in incidence or becoming more common.
Well, I feel like I've been in class all morning. I've learned so much. The otolaryngologist is an ENT, as we know it. We really should focus on what is happening when we can't breathe. 18% more air is taken in when you breathe through your nose as opposed to mouth breathing. The air is warmed. There are filters in your nose that clean the air. So nose breathing is a far healthier thing than mouth breathing. And if those tonsils at the back of the throat are enlarged, we need to check it out. Thank you so much today.
It was a pleasure.
Yes, it was awesome. Blessings.
Thanks for having me.
What a wealth of information from Dr. Barnett. So we need to keep those nasal passages clear so we can breathe properly. If you're stuffy all the time, it's not good. We need to find out why and fix it. If your child is constantly snoring loudly and it happens time after time, it may be time for those tonsils to be removed. Listen, I'm out of here. Check us the next time. Facebook, YouTube, Instagram, and our LFD website. See you next time on HD Jazz.